Honoring the Science of Sound, Exploring Music and Sound Therapy. How does sound affect the body and brain? Sound waves stimulate the brain's auditory cortex. The brain processes sounds as emotions, memories, and physical sensations. Sound can alter heart rate, blood pressure, and stress levels. The mechanisms behind sounds impact on heart rate, blood pressure, and stress levels involve the brain's auditory cortex, autonomic nervous system, and endocrine system. Sound waves stimulate the auditory cortex, which sends signals to the brain's stress centers, influencing the body's physiological response. The autonomic nervous system, including the sympathetic and parasympathetic branches, plays a crucial role in regulating heart rate, blood pressure, and stress levels in response to sound. Let's review different types of sound therapy. Music therapy. Personalized music selection for emotional response. Sound bath. Immersion in soothing sound waves. Toning. Using vocal sounds for vibration and relaxation. Binaural beats. Brainwave entrainment for relaxation and focus. Frequencies. Specific frequencies for improving well-being. Research has shown that certain frequencies can have a profound impact on our emotional and physical well-being. In hospice care, we can harness the power of frequencies to create a healing environment. For example, the 432 Hz frequency is believed to promote relaxation, reducing anxiety, and even alleviate pain. Similarly, the 528 Hz frequency is thought to repair and restore balance to the body and mind. A study found in the Journal of Music Therapy found that listening to music with frequencies between 40 and 80 Hz reduced heart rate and blood pressure in patients undergoing surgery. Research published in the Journal of Alternative and Complementary Medicine discovered that sound therapy with frequencies between 10 and 40 Hz decreased cortisol levels, improved mood in individuals with chronic stress. A study in the Journal of Sound and Vibration found that exposure to loud noise with frequencies above 1000 Hz increased heart rate, blood pressure, and stress levels with individuals with hypertension. By incorporating frequencies into our patients' care, we can potentially enhance their comfort, reduce stress, and improve their overall quality of life. Frequencies and brain waves. Different frequencies of sound can influence brainwave activity, leading to changes in heart rate, blood pressure, and stress levels. Alpha frequencies between 8 and 12 Hz indicate relaxation, closed eyes, and decreased cortical activity. Beta frequencies between 13 and 30 Hz indicate attention, focus, and increased cortical activity. Theta frequencies between 4 and 8 Hz indicate deep relaxation, meditation, and decreased cortical activity. Delta frequencies between 0.5 and 4 Hz indicate sleep, unconsciousness, and decreased cortical activity. To bring sound healing to your practice, collaborate with the healthcare team to integrate sound therapy, assess the patient's needs and preferences, and develop a personalized sound therapy plan. Music therapy may include music therapists or volunteer musicians to provide entertainment. Music therapists are trained professionals who use music to promote physical, emotional, and spiritual well-being. Here are some examples of different techniques you may try to incorporate sound into your practice: guided meditation and visualization, soothing music and nature sounds, personalized playlist, toning and vocal exercises, binaural beats and brainwave entrainment, and healing frequencies. When incorporating sound into your practice, there are some essential tools you may consider: sound machines and apps, music players and headphones, singing bowls and tuning forks, and guided meditation recordings. Don't forget to keep note of your patient's favorite sounds and songs. To create a sound healing environment, you will want to minimize distractions. Be aware of the sounds in the space. Offer to adjust the noise levels, or offer an alternative sound. To truly understand the power of sound for our patients and their loved ones, let's invite empathy to be your guide. What do you feel when you hear sirens passing? What do you feel when you hear a baby cry? What do you feel when you hear children laughing? What do you feel when you hear people weeping? What do you feel when you hear your favorite song? What do you feel when you hear arguing? Sound has the power to heal, comfort, and transport us to another time and place. In hospice care, we recognize the importance of sound in creating a soothing and calming environment for our patients. Whether it's the sound of gentle music, nature sounds, or the soft hum of a loved one's voice, we use sound to promote relaxation, reduce anxiety, and evoke feelings of peace and serenity. By carefully curating the soundscape around our patients, we can help them feel more comforted, calm, and connected. By unlocking the power of sound, we can elevate the end of life experience for our patients and those who love them.